Craniocervical junction issues, neck pain, headaches, dizziness, brain fog, shoulder pain, things like that can be coming from other areas of your neck. Imagine paying full price for a digital motion x-ray only to have the provider look at and care for C1 when so many other issues are relevant and can cause pain to mimic craniocervical junction issues. In our DMX paper, we found some clinical significant findings of facet asymmetry on this view here, the oblique view. The digital motion x-ray provides a unique advantage to us because it evaluates the cervical spine through the entire range of motion rather than only end ranges that are seen on static flexion extension radiographs or an MRI or CT. However, in many injured patients, primarily in car crashes, and chronic pain patients, facet joints appear relatively normal at the beginning and the end of motion. However, during the mid phase of movement, what we called in this one view gapping and abnormal symmetry can become very evident. These findings represent dynamic instability patterns that may be missed on conventional imaging. For example, take a look. C4, C5 facet asymmetry, when we found this, was nearly 7 times more common in the injured versus non-injured subjects. And at C5, C6, facet asymmetry was more than 3 times more common in injured subjects. And facet injuries can cause these issues, pain, dysfunction, but no asymptomatic subject in our paper demonstrated facet asymmetry at C2, C3, or C3, C4. That can mimic some craniocervical junction issues. The strongest associations that we found in our paper occurred in the mid-cervical spine, which corresponds with the levels most commonly injured during a whiplash trauma in many cases. These findings support the concept that digital motion x-ray can identify dynamic facet subluxations and abnormal intersegmental motion patterns that are frequently invisible on MRI, CT, static radiographs, even palpation and other types of tests that some of your providers may be doing. But when multiple abnormal motion findings are present, they provide objective evidence of ligamentous injuries and abnormal and altered cervical biomechanics that can lead to trauma, can mimic other things. So if you're paying top dollar for a digital motion x-ray only to be told one segment needs to be looked at, give us a call, come to our office, let us do a full analysis, see if the facets are damaged, and understand that this can mimic a lot of symptomatology and the treatments that we can help you get to get you better. Katz Chiropractic.